But, Mr. President, I came today to talk about health care. Again, I saw the leader's comments, heard his comments over the weekend. Senator Reid's comments were referring to the president's health care plan. He said there are plenty of horror stories being told. And then Senator Reid said all of them are untrue. All of them are untrue. Now, I don't think anybody has come to the floor more frequently than I have in the last 2 months, 3 months, 10 weeks. I believe I've been coming to the floor every week with the 10 weeks we were in session with stories from Missourians. And we call them, we talk to them about it. We say, now, Senator Blunt's going to go to the floor and he's going to talk about what you've talked to us about. He'd like to mention your first name and where you're from, but if you don't want him to do that, he won't do that. In virtually every case, they said, we told you these stories because we want other people to know. We want people to know how we're being affected by the president's health care bill. And if they seem to have plenty of facts backing them up, way beyond Senator Reid's assertion that all of them are untrue. They are not all untrue. In fact, I have every reason to believe they're all true, and there are many more stories out there to be told. In fact, today I wanted to talk about the changes in Medicare Advantage and had to have some discussion with our team. Well, how many of these stories are you not going to tell this week if you just tell the stories about Medicare Advantage? If you're in Senator Reid's view of the world, I guess you think the active imagination of Missourians is just running wild because they're contacting our office constantly, telling about higher premiums, higher deductibles, insurance they used to have that worked, and insurance that doesn't work. And it doesn't work because the federal government, without thinking through the goal of trying to be sure that more people had access to insurance, didn't think about all of the unintended things that could happen. The last, or the latest, I'm afraid it won't be the last. I wish it was the last broken promise, but it won't be the last, I don't suspect. The latest broken promise relates to the 15 million people in America that have Medicare Advantage, something they liked and something that they're not going to be able to have in many cases the way they used to have it. This is another application. If you like your insurance, you can keep it. Well, all the 15 million Americans that have Medicare Advantage, many of them are going to find they can't keep it. And before this is over, all of them may find out they can't keep it. The health care plan, the president's health care plan, already cut hundreds of billions of dollars from Medicare. Not to save Medicare, but to fund the new program. Now, everybody knows that Medicare is one of the great challenges we have in going forward. How are we going to maintain Medicare? And only in Washington would you be able to get by with saying Medicare is in real trouble, so let's cut it to start another program. This is the only place in America you wouldn't be laughed off the city council dais or off the legislative floor if you said we've got this one program that is in big trouble. We're not going to do anything to really reform it. We're just going to cut it so we can start another program, and that's what's happened here. We've already cut Medicare by $300 billion, and on top of this, that's Medicare Advantage. On top of this cut to Medicare Advantage, we now see that plans are being changed and being changed in significant ways. Why did we have Medicare Advantage? For states like mine, the state of Missouri, with lots of rural areas, lots of rural hospitals, not always competitive health care providers, Medicare Advantage provided the competition. And it was the competition in Medicare Advantage and Medicare Part D that made them work, and made them work at much less cost than anybody had anticipated. The marketplace works if you focus on a competitive marketplace rather than trying to run health care to be sure that there's competition out there. That's what Medicare Advantage did. And in our state, 1 out of 4 people on Medicare are on Medicare Advantage, 237,000 Missourians on Medicare Advantage. On February the 14th, I joined my colleagues in urging CMS not to make any more cuts in Medicare Advantage. There were 40 of us that signed that letter. 19 of the 40 senators that signed that letter were Democrats, 21 were Republicans. Pretty bipartisan sense that something must be happening out there to hurt these programs that's true, not untrue. And why would we continue to do that? I don't know. So I joined the Republican leaders in a letter just this week calling on Secretary Sebelius to stop moving forward with these misguided policies that do things that impact people on Medicare Advantage, that do things that impact people who had health insurance with a deductible they could afford, but no longer had that. The administration's proposals contend once again to continue to contradict that idea that if you had health care that you liked, you could keep your health care policy. If you had doctors that you liked, you could keep your doctors. And more people are seeing that that's not true. In stories that I firmly believe to be true, not untrue, no matter what the majority leader of the Senate might have said. Let me share a few of those with you today as I move toward the conclusion of what I want to talk about today. Darcy from Kansas City, Missouri is a registered nurse. She works in facilities and with Medicare patients daily. She says that the effects of rising expense of Medicare Advantage is having a real impact on the people she deals with. A quote from her letter was, "Our seniors and other Medicare Advantage members should not, as they already do, have to make choices between paying for medicines and other healthcare related expenses or paying for food or housing. She says, I hope you're able to see the bigger picture as I do as a 30-year-old professional nurse who's on the front lines each and every day taking care of these individuals and their families." Sounded truthful to me. Edward from St. Peters, Missouri, say he and his wife lived on a fixed income. Reading from his letter to me, he says, "My wife and I are retired seniors living on a fixed income. I have Medicare Advantage, which is provided by Mercy, a St. Louis-based health insurance company. I'm told I'll lose coverage next year due to Obamacare cuts. Why must the cost of Obamacare," this is, again, continues letter, "why must the cost of Obamacare, which Missourians did not want, be paid for by cuts to seniors? Please change the Obamacare law to leave Medicare Advantage alone." And again, 19 Democrats, 21 Republicans. Edward signed a letter to just last week asking that same question. Don't go any further. This letter didn't even say go back and reverse what you've done. It just said stop making these cuts that are being made right now. Ronald from Raytown, Missouri says his copay has increased as a result of the administration's cuts to Medicare Advantage plans. Here's what he says. "Please protect our Medicare Advantage plans. As you know, Medicare is presently underfunded. I do not appreciate those that permit Obama to willfully take hundreds of billions of dollars that we seniors have paid into Medicare and use those monies to fund Obamacare. I'm counting on you to protect our Medicare Advantage plans and realize that the less government involvement in our Medicare Advantage plans, the more efficient the plan. As a result of Obamacare, my copay has increased." And my guess is Ronald knows whether his copay has increased or not. And in talking to him, I'm certainly persuaded that, like the other people we're talking about today, the facts he's presenting are absolutely true. Jennifer from Blue Springs, Missouri, says that, here's what she says in her letter. "My husband and I are both on Medicare already. The copays for our Medicare Advantage plans have doubled and in many cases tripled from 2013 to 2014. And that is why I'm responding with a nightmare story." The other thing Jennifer said she did, she and her husband are retired. They're musicians, and they had a business where they would go to nursing homes and play gospel music just for their expenses. And she points out that because of the increased health care cost, nursing homes that no longer have room in their budget for something that's entertaining like live gospel music. The reverberations of what happens when the government decides that the government is better prepared to manage not just Medicare and Medicaid, as if we didn't have enough challenges already, but 16 or 17% of the economy are seen out there every day. I certainly believe there have to be some people that are benefiting from this, but the numbers don't suggest that the overall benefit is nearly as good as the overall damage. People losing insurance at greater numbers than people getting insurance. People's premiums going up more than people's premiums going down, deductibles rising, it would be nice for those who supported this to convince people that all these stories are untrue, but I think too many people have true stories to tell for their neighbors and their friends not to realize what's happening because of this government interference with a healthcare system that was working instead of doing the handful of things we could have done to make the best healthcare system in the world work better. They were there, they were offered, the president knew they were there. That's not the course we followed, and the course we're following is not leading to a place that most Americans want to be, and I would yield the floor.